Patients ask about recovery after joint replacement. It's a very common question, and it's a very important question. It's a tough question to answer. Everyone comes in with a different functional level before surgery, and therefore their recovery is personal to them. Patients that are extremely functional before surgery typically have a more rapid recovery after surgery. Important factors that determine how fast or slow your recovery will be how strong your muscles are beforehand, what kind of range of motion you have in your joint, what we do for your joint, whether it be an anterior hip versus a posterior hip, a partial knee versus a total knee replacement. These different options lead to different outcomes and recovery after surgery. What we do, all patients, to help them with their recovery is we have a robust pain management protocol. We work with our hospital team, our anesthesia team, our therapy team, and with working with all these different members of our team, we're able to control pain after surgery in a remarkable fashion, and patients are able to walk the day of surgery in almost all cases. Many patients that are on the stronger side, the healthier side, will have surgery early in the morning. They'll go up to the recovery room, and then they'll go to the therapy gym, do their therapy, and then go home that day. And sometimes the most comfortable situation for me, for my patient, for their family, is to spend the night at the hospital. And I think that's perfectly reasonable, and we do that routinely. Another aspect of recovery is, when can you drive? Did we do the right leg or the left leg? What kind of job do you have? And all these questions we'll go over in clinic in more detail once we get to know you and once we know what your goals are after your joint replacement.